The NHS is in a critical condition. 3 in 4 of its hospitals are failing. Some of its worst symptoms: people being left on trolleys overnight, poor record keeping and untrained staff.
Inadequate care is unacceptable. We all want, as individuals, for our families, friends, neighbours, that care to be safe and of high quality. Our job in CQC is to assess the quality of care, to champion that outstanding care when we find it, and to challenge poor care when we find it.
And this is what inspectors found. 3/4 of NHS hospitals in England are not safe enough. Of those, 13% were given the lowest rating of inadequate for safety, while 61% require improvement. A major reason for the failings was found to be insufficient staff and the use of temporary staff. There's also concern for other parts of the NHS. 1/4 of GP practices and out-of-hours services require safety improvement, alongside 1/3 of adult social care services. Edna Slan died in a care home in South London. Her daughter says she was neglected, left hungry and suffered unexplained injuries.
I think to have these people living in the conditions and the way they are is inhumane, and I think it's going to get worse unless something is done.
If any further proof of failings was needed, today charges were brought against Mid Staffordshire NHS Trust over the deaths of 4 elderly patients. But the government says the problems are not being ignored.
There must be no going back to the bad old days when all these problems were covered up, swept under the carpet, and they weren't addressed. And what the CQC do say today is that care is improving as we shine a spotlight on the problems.
Today's healthcare for the NHS found some care to be outstanding, but the alarming level of inadequate care serves as a health warning to people across the country. Sally Lockwood, 5 News.